All right, what about stress testing? The 4 indications for stress testing: suspected ischemic heart disease, risk stratification, particularly post-MI, assessment of the effectiveness of therapy. In other words, if you do something to the patient, like give them some medication, or we do a PCI, in other words, we do percutaneous coronary intervention of some kind, or bypass surgery, how has that affected the patient's ability to exercise? You see? Or establishment of an exercise regimen. Now, this is the critical thing you have to know to be able to understand the questions they ask on boards. I went through the MKSAP questions, the new version of the MKSAP, all 120 of them. There must be 10 questions in there that present a cardiac history of chest pain. How many of you have read through the MKSAP questions? Yeah, so there are a whole bunch of questions in there relating to chest discomfort, aren't there? Those of you who have read that? It's critical that you understand what they are asking and what they're presenting in these questions. So very briefly, I'm going to make sure you understand this. So there's 2 aspects of any discomfort. This is particularly true of someone complaining of chest discomfort. So if these are the 3 types of descriptors we give for chest discomfort: typical angina or classical angina, atypical chest pain, non-cardiac chest pain. So you have a description and precipitating relieving factors. So classical angina has both. Atypical chest pain has one or the other, but not both. And non-cardiac pain has neither. Now, how long, what's a typical description of angina? You all know what it should sound like, but I want to make sure you understand some of the parameters that make it or break it here. How long does angina last? Longer than 30 seconds, less than 20 minutes, unless someone's having an MI. So if someone tells you that the pain lasts for 5 seconds and shoots through them and feels like an electric shock, that's not angina. If someone says, well, it lasted 45 minutes and then sort of gradually went away, that's not angina. Now, what is the precipitating relieving factors? Exercise. I know emotion is supposed to cause angina, and so is eating, and I imagine there's a few cases in the history of the world where that actually happened. And somebody's going to come up and tell me about a story of theirs that the patient did that, but it's not very common. Activity is the key.